Hey, everybody. This is Andrea Pocket. I am president and co-founder of the Stigma-Free Mental Health Society. So great to have you here today on our Stigma-Free Voices podcast. Very excited today also to have Michelle Sherman with us. And Michelle, would you like to say a quick hello?
Thank you so much. So delighted to be here with you, Andrea. Thanks for the opportunity.
Yeah, so we're really excited today to dig into your history, your contribution to the mental health world, some of the publications you put out, and as well as some of your passions.
Excellent.
And yeah, very excited to have you. And for
Thank you.
everybody watching our podcast, we have rebranded from our live events to our podcast, and we're very excited for everybody joining us here today. If you do watch the podcast after the fact, please do feel free to share it. Also, do know that in the comments section on YouTube and Facebook, you can send us a comment or a question and we'll get to it during the podcast. So super, super excited. I'm going to start out with your bio, Michelle. And that sound good to you?
Sounds super.
Perfect. So, Dr. Michelle Sherman is a board certified clinical psychologist in Minnesota who has dedicated her career to supporting families of adults living with mental illness or trauma history. She is a fellow of American Psychological Association's Society for Couple and Family Psychology and was named their Family Psychologist of the Year, which is awesome, in 2022. She is the editor-in-chief of the journal Couple and Family Psychology Research and Practice. She worked for 17 years in the VA system and as a professor as well at the University of Minnesota and Oklahoma medical schools. You have a wealth of information here. In her personal life, she writes books. So this is amazing, and co-authors with her mother. So, it's all about family members who love someone living with a mental illness / PTSD. And we'll share a little bit more at the end of the podcast about the book, how you could have a look at it. And yeah, so I'm just going to jump into some questions here.
Excellent. Thanks, Andrea.
Yeah. So can you tell us about your passion for supporting families managing mental illness or trauma? And how did you get started in this area 30 years ago?
Yeah, it's been a long time. I was just a little old baby psychologist in the mid 1990s, working actually, as you said, in the VA system. And you know what, Andrea? I was just struck by all the family members sitting in the waiting room. Their veteran would go in for their brief, therapy or medication appointment and things. And all these family members would just kind of sit there with, I thought, overlapping needs, feelings, sense of confusion, certainly stigma, maybe sadness, not really knowing how to best support their loved one. I thought, they're all here. We should do something about this. And so I started creating family curriculum actually in the mid 1990s to support families in which a veteran, in that case, had mental illness or PTSD. And it's kind of grown from there. And so that's really where it all started, was this awareness of the commonality of needs among these folks and the power of community, connection, bringing people together. I will also readily add that this is not just a professional interest, but also have family members who are or have lived with mental illness. And so it's not just an academic pursuit, but one that is really fueled by my own experience as a family member who loves someone with mental illness as well. So it's really both.
Yeah, having that passion and bringing it into your professional life, I'm sure, is very rewarding and gives you an even greater insight into those who have lived experience, correct?
Absolutely. Yeah. They inform each other, honestly. They go
Yeah.
together. So absolutely.
All right. So you've been writing books with your mother,
Yeah.
Deanne Sherman, as a co-author for 20 years. So
Yeah.
how did that go, like writing together and tackling projects together?
Oh, Andrea, we are so blessed. We are so lucky. We say 99% of the time it goes great, which is a pretty good percentage for 20 years. Yeah, there's the funny story is that she has always wanted our books to have like haiku poetry. Like people write haiku, like, wow, no, people don't write haiku poetry. And so we disagreed about that. And there is no haiku poetry in any of our books. But other than that, she's an educator, she's a teacher, she's an advocate, she's a mom. And so she was really able to take some of kind of my more academic research-based way of generally writing for professionals, and how do we put this in a language, a way of accessing information that the reader, be it adult or teenage family member, can really engage with. And so it's been an invaluable and really wonderful collaboration. Because as you know, writing books is a lot of work. We've written 5 now, and
Oh,
it's a
wow.
huge amount of work and time and energy, and sometimes it's not fun. And so we've lifted and motivated each other, which has been a real blessing. And there's no one in the world, Andrew, I would rather write with than my mom.
Aw, that's absolutely astounding. I have such a good relationship with my mother as well, and she's a poet as well.
Oh, well, don't tell her I ding haiku poetry. Nothing against haiku poetry. I just didn't think a teenager was going to want to write like haiku poetry in a book.
Yeah, yeah, definitely. So you've recently published 2 new books. Tell me about that.
Yeah. So the first 3 we wrote in the mid 2000s were for teenagers specifically. And then we wrote one that just came out in January for adults who love someone with mental illness or history of trauma. And let's face it, there are a lot of such books out there. They're absolutely beautiful memoirs, some educational sort of books. But ours, which is published by Johns Hopkins University Press, is a little bit different. And that is not, this is depression. I mean, you can Google that, right? You can find the symptoms of, and there's so much now available on social media and things. And so we really took a different strategy. We really took what I've learned from my 30 years of doing therapy as a psychologist and tried to put those skills in a book form. Because let's face it, Andrea, with stigma, access, insurance, transportation, scheduling, blah, 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 most people are never going to go to like a therapy group or support group or things. So I wanted to put some of that information in an accessible form where people could literally download it on Amazon or whatever and see it immediately. We also infuse the book with both books, because we also have a new one for teenagers whose parent has a mental illness or trauma, with stories from people with lived experience. So again, it's not just 2 academics, but there are stories, exercises, reflections, quotes from people who've lived it to really hopefully resonate with the reader more. So the books are, every page has pictures, stories, activities, reflection things. They're very interactive by definition.
I really love that because for the common readers, it can be very daunting to read something too clinical or, something that feels out of reach. So I really love this with the pictures and the exercises. That's
Yes.
wonderful. Tell me a bit about that. Like what kind of exercise?
Yeah, there's a huge research base. Oh, sorry, I'm getting in geeky nerd research base, but that's who I am, Andrea. There's a big research base on the power of writing. The power of writing about trauma, about all sorts of journaling, whatever you want to call it. And so we really took that and applied it. So we would give, for example, what are some common emotions you might experience when caring for your loved one? Anger, sadness, powerless, confusion. So we have them kind of think about a time when this happened. What were some of your thoughts? What were some of your feelings? How did you cope with it? Who helped you? So we're identifying social support there. We're doing a little cognitive behavioral therapy of addressing thoughts and feelings. We're talking about healthy coping. So all this is getting them engaged. They don't know it maybe, but they're doing cognitive behavioral therapy
Yeah.
themselves. So that's what we did is stories and getting them to reflect and think about, how do I talk about these issues? What issues are most challenging? A huge focus in all of our work, Andrea, on resilience. The name of our company is Seeds of Hope Books.
Yeah.
We are very much into instilling hope and believing for recovery for everyone, all these sorts of principles. So they're all interactive with that absolute focus on hope.
I love that. At Stigma-Free Mental Health Society, we have a thread of hope in everything we do. So I'm so glad we can collaborate with you.
Absolutely, Andrea. It's essential, isn't it?
Yeah, collaboration is essential, coming together,
Yeah.
lifting our voices together. Yes, 100%.
Absolutely.
Okay. So both of your books address the role of stigma surrounding mental illness, and the books have whole chapters on this topic. And I was wondering, what role do you think stigma plays with respect to being a deterrent to seeking help?
Oh, I think it's huge. I think it's huge. There can be so many fears that serve as barriers as well as logistical things. I just think of so many clients I've served over the years who have described such fears and hesitation about coming in. Like, are you going to lock me up? Is this going to get reported to my work? Am I going to lose my job? Don't tell anyone. I don't want people to know. There continues to be such great fear of the consequences. There's also, I think, a sense of pride of I should be able to handle this on my own. As I said, I work with veterans, for many years and their families, and there's a sense of stoicism and self-sufficiency and don't ask for help that is not just in the veteran culture, but the sense of I should be able to figure this out on my own. And so I think that's a huge stigma. And if we broaden stigma more broadly, we talk about not just kind of the public stigma, the personal stigma, but societal sort of stigma, which is manifested in not as much money going to research, not as many dollars going to having programming and things. And so just access is affected by broader stigma. And so I think stigma is affecting access to care, ability to access care, insurance coverage, so many things at a broad level. So I think it's huge. The other thing I think it very much affects that I write about in both books is how to talk about it with others in terms of, again, if I'm a teenager and my mom has schizophrenia or PTSD, whatever, what do I tell my friends in terms of why my mom doesn't come? Or if my dad does come, why he maybe is looking disheveled or is really angry at the ref or things like that. There's a lot, we as adults struggle with this. How are we supposed to know how teens are supposed to deal with this? So we have a lot of support for the readers about how to talk to others because stigma is a huge, huge issue.
Yeah, no, that is so helpful. I know my mother has schizoaffective disorder, and as a young teen, I was ashamed when she would show up to things like my graduation. She would act out a character, and I carried a lot of guilt because of that
Um,
as I aged. And I feel like if I had a resource or someone to talk to or just to learn about my mother and the situation she was in and to understand growing up what stigma was,
yeah.
because in both of our growing up, that wasn't talked about in schools.
Absolutely. And I think we've made progress. I think there's progress still to go. But I think teens are much more literate and there's much more in the media, social media. Of course, some not great information, but I think teens are much more fluent in the language of mental illness, which is a good thing. And again, you look at broad scale research, there is some decreasing public stigma towards some things like
Yeah.
depression and anxiety, but sadly not for others. Like schizophrenia, sadly, the public stigma continues to be high and is actually not going down. So absolutely, that's really why we wrote this, and frankly, there are not really any other nonfiction resources for teenagers. I'll tell you a really quick, kind of neat story. We
Yeah.
connected with some people in Iceland, psychiatric units in Iceland, and this nurse practitioner who works there, who has really found our books to be helpful, said she gave a book to this, I think, 12-year-old young girl. And this little girl got the biggest smile and tears in her eyes saying, "This is for me."
Yeah.
Because there aren't other books out there. I mean, there's a book like if my mom has cancer, if my grandpa has Alzheimer's or things, and that's great. But there aren't any other books for these teenagers. So it sustains our passion that maybe these teens can be seen because
Yeah.
they're often so invisible in the mental health care system, et cetera. Sometimes at admissions, you don't even ask, do you have children, much less how are the children doing? So this is my life passion, honestly, is trying to raise awareness.
No, I love it. No, so important, so needed, and something that's been so absent in the past. And
Yes.
definitely we have a lot more work to do.
Yeah, absolutely.
Okay. So, can you describe a recent WHO study, World Health Organization study, you found interesting that addresses this topic as well?
Yeah, it was super interesting, Andrea. It looked at, it was, as you said, done by the World Health Organization, by a very large number of people, 55, I think, million people across 20 some states. And it looked at basically a structured interview for mental health symptoms. So they were able to see, do they actually have mental health problems? And then what percentage of them thought that they had mental health problems. And it was actually less than half, which really speaks to, I think, a number of things: lack of education, lack of awareness, sorts of things, as well as this kind of anosognosia concept in which people may not even recognize that they have an illness. And so there are a lot of gaps there between you're having a lot of severe psychiatric symptoms, you're not even realizing that it's a problem. And then we go from even realizing it's a problem to what percent seek help, to what get any help, to what get competent help. And the sad end of the story, and this is again a very large international study, was all the people with symptoms of serious mental illness, less than 7% got quality help. That's
Oh,
really sad to me. Talk about a huge gap, right? Between the number of people in significant distress, number of people getting the quality evidence-based kind of help. So we've got
mm.
a long ways to go. And stigma is absolutely one of these driving factors.
For sure. And for different kinds of stigma, can you describe them a little bit for our audience?
Yeah, you bet. So there's kind of public stigma that we think about people using derogatory terms, or I think even, just frankly, I got another story just last week. A large newspaper in my city used the word committed suicide, which I think is quite
Mm.
stigmatizing. So actually, I emailed this person and said, hey, FYI, we tend to say this. And he was like, oh, thank you. I didn't mean to. So how can we look at the messages media and others are giving in terms of the public use of the words like crazy and all these sorts of things? How come? So there's public. Then there's personal stigma, is my own feeling bad about myself for having the mental illness. Not feeling like I have the hope, the abilities, the ability to recover and have a meaningful life. And so all that self stigma that's put on. And then there's family and friend stigma. Other people, kind of as you were describing, like I am embarrassed because of my mom or because of my dad. And so there are lots of different kinds of stigma. There's certainly institutional stigma, which is what I was referring to a couple minutes ago, in terms of discrimination in hiring and access to housing and finances, dollars given to research and things like that. So there are a lot of different kinds of stigma. I really appreciate greatly the research and work by Dr. Pat Corrigan out of Chicago. He's really been such a leader in terming these different kinds of stigma. And then, frankly, to jump to the chase for a second, what his research has found to be most effective is not, academics like me coming up and say, don't stigmatize or things like that, but it's really rather people with lived experience sharing their stories. And
Yeah.
I think it's a lot of what your podcast and stories are, is people really talking about, hey, yeah, I have bipolar disorder and I am doing well. I'm doing this and whatever else, but really getting to know people are more than their illness, and people are leading very productive, positive lives.
Yeah. Yeah. No, that is so vital. And I'm so passionate about eliminating stigmatizing language. And I teach this in my presentations in the schools to the kids.
Great, great.
Yeah, because how often do we say, "Oh, that person is psycho
Yeah,
or crazy?" And I
yes.
do I do understand, like, people who die by suicide die by suicide. They're not committing a crime,
Yeah, exactly.
right? And I think a lot of times we need to understand as a society that, people with mental illness should be treated with dignity and respect, and our language evolves over time and
Absolutely.
should in this community as well, right?
Because language matters, right? The
Yes.
words that we choose, how we say them, they make an impact. We may not think about it. You see so much advertising about crazy this. There's a donut store in the United States called Psycho Donuts.
Oh,
um,
wow.
I know it's horrible, and actually, some of the real advocates kind of try to say to them, "Hey, don't please use something else." And unfortunately, they grew. They didn't change it, but they have a donut with different names of different mental illnesses. It's horrible.
Oh my
And
gosh,
so,
really?
yeah,
Wow,
yeah.
that's shocking.
It is. It's really unfortunate. And so sadly, I think we have a lot of work to do in that area. But some people, just even like this report the other day, it's like, oh gosh, thanks for telling me. I will change. And NAMI, National Alliance Mental Illness, and other organizations are putting out statements to help the media to know how to speak correctly or use a non-stigmatizing language. So I think there's progress, but there's absolutely ways to go.
Yeah, really appreciate NAMI. That's amazing.
Yeah.
Um, so reducing and eliminating stigma, what can we do on a day to day?
You know, I think the biggest thing is the individual conversations. I think it's when you have a conversation with someone and they say, "Oh, that's crazy," or "You're crazy," to actually, in a trusted relationship. I mean, this reporter, like I said, was a total stranger. He didn't know me, and I said that. But I think it's even more powerful when it's with people we know and love and interact with every day, that we can offer those feedback or context. So, when you say that, it either makes me or concerns me about how you're representing that. And again, another story. In a new job I had about a decade ago, I made a comment about an adjective describing a young child, actually, and it was very, I thought, positive adjective, was articulate. And this person came to me and commented and said, Michelle, actually, you know what? When you use that adjective, it really is fairly derogative in my culture. It's like, oh gosh, I had no idea. I'm so sorry. Because like, well, why would you say they're articulate? They should be articulate, sort of things. But it came to me, the point of this story is she came to me in kindness in respect and in trying to be helpful. That's what I think changes it. Certainly we can have articles and teaching and going into schools. All this stuff is magnificent and essential. But to me, it's more the everyday interactions and giving that feedback to people who hopefully can change their behavior.
Yeah, and also doing it kindly and
Yes.
gently,
Yes, Andrea.
inquisitively, right? Instead of getting angry at each other.
Absolutely. Huge, huge.
Yeah, yeah.
Absolutely.
Okay, so one area you're very passionate about, and we've talked about, is how mental illness or trauma in parents affect their children.
Exactly.
So, how do you think, as a society, we are doing at seeing and supporting these young people?
A letter grade F. And I can speak to the United States because that's where I live. I really think that there's great opportunity for improvement, that there's very little, be it through NAMI or otherwise, systematic identification or support of these kids. I mean, I certainly connect with people in Canada, like I said, Iceland, UK, Australia, who say, you know what, these kids actually have rights. And so we need to, as a country, identify and support them. We're not even there in terms of identifying them in the United States. And their research is really clear, right, in terms of the short and potential long-term impacts of a lot of ways on these young people and their increased risk due to nature and nurture. So there's all sorts of reasons to do it. But sadly, I think they're often invisible in the family system. And it's because the person with the illness may be really struggling themselves. Other family members are trying to, support them. And so who's even thinking about or supporting the children? And as I mentioned a few moments ago, mental health professionals, myself included, don't always do the best job of, hey, how is this impacting your kids? How are they doing? So my hope is to move the needle, even, 1%, to try to increase the attention to and talking about and supporting these children. I think part of the issue is providers don't know what to do. What don't to say. They don't
Yeah.
have go to a NAMI group because they don't exist. In the United States of America, they don't have a book or a resource, which again is why we wrote this book. They don't know how to help them, and they're like, well, I'm going to open this topic up, and it's a big issue. The other big elephant in the living room we must address, of course, is the fear of Child Protective Services getting involved in terms of if a parent discloses my kid is struggling or I'm having a hard time being a parent, the fear of their children being taken away, which is kind of the ultimate fear. So this is a nuanced issue that we must be honest about. But I think we've got a long ways to go in improving, our ability to identify and support them.
Yeah, 100%. So, how do you hope your new book, I'm Not Alone, could help teens and families?
We really hope that, just even as I mentioned with my story of the child in Iceland, that they can be seen, that they're recognized. And then we really provide information in teen-friendly sort of ways and trying to help them understand what mental illness is, that they're not to blame, they didn't cause it, the whole hope for recovery. And then the whole part number 2 is really about their experience, about their feelings. How do they talk with their friends? What do they do when there's a crisis? How can they navigate and come up with a strong support system themselves? How can they really build their own resilience? And so it really is not only really honest information, but is very hopeful and empowering that, you know what? Yes, you are at increased risk because that's the truth. And there are things that you can do about it to either prevent the likelihood of your developing mental health problems or if you do, empowering you with skills for how to cope with them more effectively. So
Yeah.
we really hope they feel seen and empowered and how to cope with what can be a lonely, at times really difficult journey.
Yeah. So, where can people access your books?
Yeah, anywhere. Yeah, Amazon, Barnes and Noble, Indigo in Canada, Ingram. Pretty much anywhere. You can read sample chapters and learn more about them on our website, which is www.seeds with an S seedsofhopebooks.com. And so there's a wealth of information, other free resources and things there. But the actually books themselves, you can get anywhere.
Great. And so, if people want to contact you or learn more about your work, it's seedsofhopebooks.com.
Exactly. You can contact me through that. Exactly. And the
Okay.
one for adults is called Loving Someone with a Mental Illness or History of Trauma,
Yeah.
Skills, Hope, and Strength for Your Journey. And we use the word your intentionally, Andrea, because it's not like, how can I better help my loved one? Most people are already doing a pretty good job at that. How are you doing at taking care of yourself as well?
Yeah, 100%. Do you have a message for people out there, perhaps for parents? Let's specifically look to them, parents, guardians, or caregivers
Yeah.
who have young people in their lives or children. Is there something, and they're dealing with a mental health issue, is there some kind of message you can send to them?
Yeah. One of the very best things you can do for your children is to take good care of yourself. So you're choosing to access services, peer support, AA, whatever it may be, is a huge, huge step in the right direction. Secondly, parenting is hard for everyone, and experienced mental illness can make it harder sometimes. There are people in your community who can and may want to support you. It could be your next door neighbor, an aunt, an uncle, a clergy member, a mental health professional, but there are people out there. Let them. Don't let the stigma and shame keep this a secret, because that is not helping you, is not helping your child. So allow other people to be part of your community of raising your children, and realize that there are resources out there to help you. You don't have to go through this by yourself. We want your children to know that they are not alone, because we do know 1 in 5 kids has a parent live with mental illness. This is not a rare thing. If we look at symptoms, mental health symptoms is like 1 in 3. Okay. This is not a unique or rare event, but we're not talking about it. So it's okay. Good for you for getting help, and just help your children connect to whoever would be appropriate for them. They don't have to go through this by themselves either.
Yeah. Wow, Michelle, it's been absolutely astounding to talk to you today. Thank you for everything you do for our communities globally, and much appreciation, because I feel like with people like you, we can keep bringing this conversation forward, eliminate the stigma.
Yeah.
Families need to know that there is always a place for them in this world, and that they shouldn't be ashamed of having a mental illness. And that, I feel, is a strong message. So thank you so much.
Andrew, thank you. This was just lovely. Obviously, you and I are preaching to the choir. We see things so similarly. And so it's just a delight to share time with you. Thank you for the opportunity.
Okay, well, stay on the line so I can thank you personally after the podcast.
Great.
And just wanted to say thank you to everybody for listening. Much appreciation to our community. Again, if you are viewing this after the fact of the podcast being on the air, please feel free to share. And any comments or questions, we will do our best to answer from Stigma-Free Mental Health account. And please check out stigmafreementalhealth.com. We have a lot of programs, education, preventative education, especially for young people. And we want everybody to access our resources as well for rural and remote mental health too. So thank you so much, Michelle. And thank you, everybody. I hope that everybody has a wonderful day. Thank you.